The fall 2025 season of Investigation with Dr. T is proudly centering on our institution's newly designated prestigious R1 Carnegie classification. We're seizing this moment to go deeper, think bigger, and highlight the game-changing work that's happening. So each episode this fall is going to spotlight cutting-edge research initiatives, groundbreaking studies, and powerful doctoral dissertations led by PhD and EDD students, research-engaged faculty, field-based research practitioners, and community partners. So we're going to focus on vital sectors like education, criminal justice, human services, while also welcoming special guests from the College of Psychology, College of Dental Medicine, and the College of Computing and Engineering. And join us as we celebrate our journey into R1 territory and explore what it truly means to lead with research, lead with scholarship, and lead with purpose. So stay tuned. Fall 2025 Investigation with Dr. T. It's going to be unforgettable. And so tonight, my guests are the chief of the Davie Police Department, Stephen Kinsey, and Dr. Mathew Goodnow from Nova Southeastern University. Chief Stephen Kinsey has led the Davie Police Department since September 2020, bringing over 30 years of law enforcement experience, including roles as undersheriff at BSO, assistant chief, Fort Lauderdale Police Department, and he's commanded all three bureaus: operations, investigations, and administration. And he has lived in Davie for more than 24 years, lucky man, giving him deep insight into the community. He's a graduate of the FBI National Executive Institute, National Academy. Chief Kinsey holds an MS in Public Administration from FIU, a BS in Crim with a sociology minor from FSU, and he is active in several professional associations and currently serves as vice president of the Broward County Chiefs of Police Association. Dr. Matt Goodnow is a military veteran with over 25 years of law enforcement experience and a PhD in criminal justice behavioral science from Nova Southeastern University. Dr. Goodnow specializes in developing innovative programs that improve public safety outcomes and strengthen relationships between law enforcement and the communities they serve. He's dedicated to creating impactful, measurable initiatives that enhance transparency and accountability in law enforcement. His work reflects a deep commitment to collaboration, innovation, and improving public service, with a focus on advancing police strategies through research-driven approaches. So that's a lot to say. That's a big mouthful, right? I am so excited about tonight's episode of Investigation with Dr. T. I am Dr. Grace Telesco, and we are live streaming on the Fischler College of Education School of Criminal Justice YouTube channel. And as I said, tonight we have two amazing guests. We're going to be diving into a powerful and deeply relevant conversation about the intersection of policing and mental health. And in communities across the country, law enforcement officers are increasingly on the front lines of mental health crises. One of the most critical tools used in Florida is the Baker Act, which allows for an involuntary evaluation of individuals in mental health emergencies. But what do these encounters actually look like on the ground? What can the data tell us about patterns or gaps or opportunities for better responses? So to help us unpack this, we're joined by these two incredible guests. As I said, Chief Kinsey of the Davie Police Department and Matt Goodnow from Nova Southeastern University. I'm going to spotlight them both now and bring them on. And where's my chief? Here he is. All right, great. So thank you both for joining me look, you guys are extremely busy people, very busy, and have, life and death jobs, where people's lives are at risk at times, and you come in and you provide public service to them. So it is not lost on me that you could have easily said Dr. T, look, I can't. I'm really slammed. But you know what? No matter what, when I ask you to do something, you do it for me, and I want you to know how honored I am and how much I respect and honor our relationship. So, Dr. Goodnow, welcome. Chief Kinsey, welcome. Anything you guys want to say before I start digging into the big stuff? Chief, you want to say anything?
No, it's just a pleasure to be here, and as always, I appreciate the partnership that we have with NSU and with you specifically, and glad to be on tonight.
Great, thank you, Doc.
I'm happy to be here. I always have time for you, Dr. T. So
Aw.
anything I can do to help out, and as everybody's going to find out, the partnership with the Davie Police Department made this happen. So I'm looking forward to discussing the research and whatever questions you have, I'd be happy to answer.
Awesome. All right. So I'm going to start with Chief Kinsey. I'd love to start with you because, here's the partnership that happened. We partnered with you a few years ago. It feels like, could it be 3 years?
Probably at least, yeah. I've been here 5 years now as chief, and it was shortly after that when we first started talking and building that partnership.
Yeah. And I know that one of the things that we were hoping to partner with you and collaborate with you on was research. And you had a research question already in mind. You had something that was, you were curious about. Can you share with us why this particular research question emerged? What specific problem or concern did you have?
Yeah, so it's interesting how that started. So in September 2020, I was selected to be the Davie Police Chief. And for the first 2 weeks, I was fortunate enough to work with former Chief Pat Lynn. So he was kind of like a chief field training officer for me for those first 2 weeks, kind of show me the lay of the land of Davie. And over the first weekend, we get calls like most police departments. Every morning, I get something called a shift pass down, and basically that highlights, the big calls of the night, something that might generate media interest or a good arrest or something that may happen. And over the weekend, I see that there was a large number of Baker Acts, way larger than I would have thought would happen with a town and a department in Davie. So Monday morning, I came in and I questioned Chief Lynn and I said, "Hey, what a busy weekend with Baker Acts! That was crazy." And he said, "No, that's pretty much normal for Davie." Now I've worked at two of the actually the largest police departments in Broward County. And that was unusual for me, that number. So I asked him, now I got a probe. I'm the new chief. I'm trying to find out, hey, what's the reason behind this? Did you guys ever look into this? Pat Lynn is a very smart guy. Pat Lynn had been chief here for 10 years. And he said, yeah, we actually did look into it. We went as far as to pull every single police report from a year where we had a lot of Baker Acts to see if maybe the officers were misidentifying this or there was something wrong. And he said every report that we read met the criteria for Baker Act. So I thought that was something that was really important for me to look into because, again, the number and the volume of Baker Acts in the town of Davie seemed to just be way larger than it should have been. And that's how this all started.
Yeah, I think that it's important for us to tell folks who might be watching like exactly what the Baker Act is. And the Baker Act, it's coming from a piece of legislation. I think that maybe sometimes civilians or the community members might misunderstand and think that police are just going in there and just grabbing people and bringing them, wherever, whether it be to jail or to a psychiatric emergency room. But, we're mandated, right, to do that because of legislation. Can you speak to that at all about what the Baker Act is?
Yeah, I mean, in the simplest terms, basically, if we feel when officers arrive on scene, if we feel that someone is going to be a danger to themselves or to others, or aren't capable of making a decision for their mental health or their health and well-being, then we have the opportunity and the obligation to take them into custody, sometimes involuntarily, and bring them down to a medical facility so they can get evaluated. That's the simplest terms for that. And it's not an arrest. They're not in custody. It's just an involuntary detainment for us to be able to get them the help that we think they need. And again, the most criteria that we use the most often is, are they a danger to themselves or are they a danger to others?
And, I think that, having 20 years in law enforcement myself in New York, we didn't call it a Baker Act. It was called something else. It was a mental hygiene law. Same exact thing, just not called Baker Act. And when you take someone into custody involuntarily to bring them to a facility that's going to help them. And I'm going to put those help in quotes. We're hoping that there's a whole system in place that they can really get the resources that they need. And not always is that the case, that there's resources within the community itself.
Yeah, that's accurate. And we don't even know at the time that we're taking this action, this Baker Act. There's many different medical facilities in Broward County and across the state and across the country. So we don't even know necessarily who we're turning these people over to or their level of experience. And I'm not trying to disparage any of the doctors or nurses or mental health workers that work at the hospital. They do a great job. But yeah, I mean, just like police officers, people are different. They have different experience, different opportunities. So as we turn them over, depending on what hospital in Davie we go to, it could be a different experience for them as well.
And they're also under the law and guidelines and guardrails. It can't keep someone, indefinitely, right? So, 3 days usually, right, for an evaluation, and then, releasing them into the hands of the mental health community. But maybe there's not a lot of resources that are there for them. And then what happens is we keep seeing the same people over and over again seeking assistance, right? Call after call. And that's kind of the story.
That's correct. Yeah, I mean, 72 hours is actually the maximum outside of some extraordinary circumstances. Sometimes they're released way sooner than that if they're able to see the provider or see the mental health professional. They could be that's just the maximum they can be kept is those 3 days, that's 72 hours. It could be much earlier on many occasions.
Yeah. So Dr. Goodnow, now enter the researcher, right? So Dr., as I said in his bio, not only 24 years of law enforcement experience currently, but also an SU graduate in the PhD in criminal justice. He was my student. I'm very proud to say that. I really admire him and honor his work, and I think that he's brilliant. And I'm not just saying that because he's a guest on the show. I really am a big cheerleader of his. So, Matt, tell me something from your side of this collaboration, because we collaborated with Davie, and then we had the perfect guy to really, carry the ball down the field, and that was you, right? So I came to you and I said, how would you like to do something really cool in collaboration and partnership with the Davie Police Department? And so how did you approach the study? We could talk about it methodologically, strategically, to make sure that it truly captured the realities on the ground for the Davie Police Department.
Yeah, so first and foremost, I was actually a little bit caught aback. I being in law enforcement for 24 years at the time, law enforcement isn't really research based. So I was a little caught off that a police department was looking to get to the bottom of their issue. So my hat's off to Davie Police and Chief Kinsey. Just the fact that they wanted to find the root cause of what was going on, made this research worthwhile. And just to touch on a little bit what you just said before is that, I've been on the street, I've handled these calls, and like the chief said, the maximum time is 3 days. But I was running into individuals day after day after day doing Baker Acts, trying to figure out why they were back on the street or why they weren't, being taken care of in a facility. And so it helped me understand that this is just merely a temporary fix to a larger problem, a societal problem it's very systemic. And when I met with Chief Kinsey and Assistant Chief Poland, the one thing that stuck out is, figuratively, they wanted to know if something was in the water because, like the chief said, there was so many Baker Acts that you just can't wrap your head around it. So we went from there. So the partnership started. Everything I asked for to do the research, they were extremely transparent. We looked at 3 years of data from January 2020 till late in 2023. We analyzed over 2,000 calls for service that were just specific to Baker Acts. In that period of time, the Davie Police Department handled over 366,000 calls. So when you do the math in your head, it seems like a low number. So we went in, and I think you mentioned earlier that I wanted to do a quantitative study. I wanted to mirror what the officers were seeing on the street and what they were doing. So we looked at a variety of factors. First, we did inferential statistics. So we were going to look at, correlations, t-tests, regression analysis of variance, which basically compares means of a bunch of different groups that we were looking at, whether it was demographics. Cities are built out into different zones. So Davie had specific zones that they respond to. I believe it's 19 zones. So we looked at that, and then we broke it down even further, which really wasn't planned part of the research, but just for my knowledge, I wanted to break it down descriptively and kind of look at, race, sex, age, and then I also wanted to determine who was calling. I thought it was very interesting to determine who was calling the police to get people these help that were in crisis. And basically that's where it started. So we started, analyzing the data and kind of getting the results from there.
So Matt, I'm gonna ask you this next question because I think it'll help set up Chief Kinsey's question, and that has to do with the discoveries. So as the study unfolded, what were some of the key insights or discoveries that you made about the relationship between mental health and law enforcement interventions in these cases? So basically, your findings. So here we are thinking, wow, there's a lot of Baker Acts going on, but when compared to other counties or Broward County in general, overall, or even the state of Florida, what did you find?
So I'll start with the best first, because I really think if I could give an award out, I would. I really think it's a monumental statistic, but I will tell you that the national average for law enforcement departments, both state, local, and federal, utilizing force on mental health calls for service is about 17%. The Davie Police Department was 0.41%. And I just think that's remarkable, because it goes towards, not only their leadership at the department, but as you can see, everything that they're putting in to try to train their officers to solve the problems from that root cause, and to identify how to resolve or mitigate the mental health crisis within Davie, but really within the nation. And I think that training builds awareness, and experience builds restraint. So I think it shows, or it lends itself to the amount of training that they're getting. But going back to the original question, sorry.
No, that's cool. That's, that's one of the biggest findings of this,
Right.
right? So that was number one. And when you say 17%, can you explain that to, let's say, a civilian population, a non-research population, someone who, so what does that 17% mean?
Well, 17% of the calls. So if you have 100, you respond to 100 calls for service, just specific to mental health or people in crisis. 17 of those individuals are going to experience the police using force on them to involuntarily take them into custody and bring them to a hospital. And a caveat to that that I looked at prior to the research was that Bala and Jones, who wrote or did 2 pieces of research on this, actually found that the process of the Baker Act and involuntarily taking someone into custody to get help was actually more traumatic on that individual. So, and it correlates to what we see on the street, is that the first time you deal with a person, it's a little more trusting. They understand where they're going. They understand why. And then the second and third time, because of that trauma they experienced, it gets a little harder. And they want to resist a little bit more. And law enforcement, as much as we want, eventually we have to end the crisis and get them into custody. So I think it goes back to training, taking time to understand what the individual's going through, talking to their family, finding out what their triggers were, if there's narcotics or alcohol related, if there's other comorbid factors that go into what it is. But anyway,
Yes.
getting back. So we looked at, within Davie, we looked at CIT training. So CIT training is crisis intervention training. It was developed in, I want to say 1988, Memphis, Tennessee. And it's basically a 40-hour course that you put your officers through to learn how to identify trends or behaviors in the mentally ill population. And that is supposed to help resolve or de-escalate the situation.
And Chief, I want to just jump in here. And I know it's not one of the questions that I said I'd ask, but I'm always going to give you a softball pitch anyway. Davie, Davie is remarkable in so many ways, but the Davie Police also, isn't it true that all of your officers are CIT trained?
They're not all trained yet. When I came on board, that was my goal, still is my goal. So we're about 75% there, I think. And as we get the new officers that come on board, so that's going to be the final goal. We will reach that goal. As you know, being in law enforcement, and probably even in the private sector, taking someone away from their primary assignment for 40 hours is a little bit of a burden, but it's so important, and so important to me that as opposed to having to call somebody else from another zone or another area, that every single officer that responds to a mental health call is going to have that training, and we're going to get there. And we're about 3/4 of the way there.
And there's something else that you do that's like amazing. You've been on my show before and we've highlighted Davie Police before, but you have something called a special needs registry. And that's remarkable. Can you just talk about that just for a second before I ask you about your when you heard the findings, what was your reaction?
Yeah, basically that's a project that was implemented here at Davie PD, and we reach out to our residents, obviously through the education and all the social media platforms, or just in person conversations and contacts. And if you have an elderly parent with dementia, or you have a child with autism, or any type of that broad realm of special needs, you can fill out a simple form with us. We give you a bracelet, we give a sticker for your house, and basically we'll flag that call in our dispatch center to say, hey, if you go to this call, you might be dealing with a kid with autism. And we know sometimes, audio interpretation is different with them, and loud noises and fast movements. And we want officers to have that information. And then we do a follow-up every year to update the list. There might be times when somebody's moved away. There could be times when someone says, hey, I was on the mild end of this, and I got the help I needed. And I don't think, and people have done it on themselves, or you can do it, like I said, you could do it for a parent, a grandparent, a family member, a brother, sister, a friend. And like I said, it just lets our officers know, hey, you're going to this call. Somebody does have special needs, and just have that extra awareness when you're there for the help that you're trying to provide.
Yeah, it's really remarkable, and I think that that's what makes the partnership between you and the community, you being the police department and the community, so tight and so effective. So now we have the big presentation. Dr. Goodnow gives his results to you guys, and what's your reaction?
There were some things that weren't surprising to me, and I think probably things that weren't surprised to Matt. But there was definitely some things that were surprising to me. Davie's like any other area. We have 108,000 residents. We're kind of separated between east and west. West is a little more rural. East is a little more industrial, a little more busy. And I was surprised that the disparity in the Baker Act calls wasn't heavier towards the east side of Davie. Another thing that surprised me was the number of Baker Acts from the CIT people. Now, obviously, when that training is provided for them, my expectation was that there would probably be more Baker Acts, because hopefully they have a better sense of, the awareness of how to get these people the need, and how they fit that Baker Act criteria. But it was a large number, I think around 3,000 more from the CIT officers. So that was surprising to me. And I also thought that the highest level, there was a bunch of factors that Matt looked at as far as the age factor. I thought maybe the juveniles might have been a little bit of a higher number, where it turned out to be that 19 to 35 group of people. So those were the things, that kind of stuck out to me in the beginning. Of course, like I said, some of the things as we know, weren't surprising as far as like the importance of early intervention. And things like that. And I think the last thing that was surprising to me was that some of the experts or some of the providers that Matt spoke to or reviewed their research that didn't feel that the Baker Act was an effective tool for narcotics users. And
Mm,
that's something that also kind of was a little surprising to me, and something I never thought of, to be honest with you. But
yeah.
obviously, those people that use those illicit drugs, um, it's not everyone's just trying to get high. Some of these people do have serious mental health problems, and there might be different reasons for that. But it seemed like, and Matt, correct me if I'm wrong, but it seemed like those providers or those experts said that's not necessarily the best course of action in certain cases.
Correct.
You want to speak to that? You want to speak to that?
Well, I think it goes, unfortunately, there's a lot of stuff that we don't see in the background, and I think, in my experience, and I'm sure the Chiefs, um, these facilities are overwhelmed. They're run out of beds. The patients are in the hallways. They're interacting with sometimes other patients while they're waiting to get a room. So I think realistically, if there is substance abuse problems, they're really trying to push them towards the Marchman Act, which is specific for drug use, because they want to treat the drug problem first, so then they can focus on the mental health problem. They can't treat the mental health problem if they're going to continue to use the illicit substances. So I think that was the thinking behind that. Of course, when you look at law enforcement, like I said before, we're not all doctors, right? We don't understand these concepts. The normal law enforcement officer on the street doesn't really understand the difference between one mental illness versus another. They just understand that the behaviors that they're displaying leads them to believe that they're going to harm themselves or others, and that's what triggers the Baker Act. So my goal in the research and future training is to be able to train officers more than that 40 hours, to be able to get them to differentiate between whether it's a behavioral problem or a developmental problem, or if there are other factors involved that could be substance abuse. And then one of the other results specific to the city of Davie is that there are zones that correlated with more narcotics arrests or more narcotics activity had significantly higher, more Baker Acts from those areas.
Interesting. So do you think that that had anything to do with, they call it like a drug psychosis? Do you think that's the explanation for that finding?
I think people with uh, mental health problems want to do anything they can to self-medicate, to not be um, locked up in a hospital or a mental facility. So I think they try to solve problems on their own, and then I think the substances kind of take over. And then you have the problem of trying to identify what is actually causing it, going back to, do we Marchman Act them? Do we Baker Act them? Um, so
Right.
it's just a very difficult problem to deal with.
Chief, what do you think? What's your take on it? You've been in law enforcement almost your entire adult life. So, what's your take on this in terms of the intersection of drug use, substance abuse, and mental illness?
I think Matt nailed it perfectly, actually. I think that these people, especially these repeat offenders, they're trying to find a way to navigate through these mental health issues, whether they recognize them or not. Um, and the trauma that we spoke about earlier about sometimes going through that Baker Act process, this is their out. This is their avenue to say, I don't think I'm crazy. I don't think I need help, but I have to find a way to survive. And sometimes that leads them down the path of narcotics usage, which almost always leads them down the path of narcotics addiction, and creates not only mental health issues, as we know, but just health issues in general. So,
Yeah.
yeah, it's very important. I mean, to take that in steps, as Matt said earlier, which is the first thing you have to do is get them off of those narcotics, get that out of their system, and work on that addiction, which is so serious, and that's a disease, as we know, and then try to zero in on the mental health aspect of it.
Yeah, and I think that those who suffer from the, and I'm so glad you say you're calling it and identifying it as a disease. So the disease of addiction, right? Getting clean is one thing, but now you still have this other issue, this disorder. So it's dual diagnosis, as Matt mentioned earlier, comorbidity, which means, these two things going on at the same time. If if someone's suffering from a mental health issue or disorder, let's say schizophrenia, for example, where there's hallucinations and all kinds of the flat affect, all of the symptoms that go with schizophrenia, and they're seeing a psychiatrist and they're been diagnosed schizophrenic, provided medication, but then there's a breakdown with medication and they're not medication compliant. And now they're kind of off to the races. And then this impacts their clean time. It impacts recovery, right, for them. So those who suffer with dual diagnosis are really, really in a very, very difficult spot, both with addiction issues as well as the mental health piece that maybe they're not getting help for. Matt, what do you think? And then Chief, can double dip on this.
Well, I think you're 100% right, and you triggered something in my mind talking about that, because I have actually gone to these facilities and spoken to these doctors and tried to figure out why the person we Baker acted 12 hours ago is back on the street. And what I determined is that we are taking the person off the street while they are in crisis. And if they are so out of control that we're taking them and we feel that they're going to hurt themselves or others, one of the first processes that the hospital will go through is they'll medicate them. And whether it's Ativan or some other drug to calm them down. Well, once they're calmed down and out of crisis, they're pretty lucid. They could probably have a conversation and talk to the doctor. And at that point, they see no reason to further medicate, or they prescribe them medication and they kick them out the front door. I'm not going to get into all the insurance problems, but a lot of this is based off insurance needs too. But once they get out on the street, a lot of these people don't have, they don't have Aetna and Blue Cross Blue Shield, and they're not going to CVS to pick up their prescriptions. So they come off their meds and the cycle starts all over again. And so
Exactly.
it is a huge problem.
Chief, what you want to weigh in on this?
Yeah, and I agree with what he said. There's so many different factors and so many different entities that are involved in this process. We're just the first step in the original Baker Act. And I think something else that's important and that we talk about all the time is, we have officers out on the street that are being asked to do a multitude of things. They're not mental health professionals, but yet sometimes they have to step into that arena. They're enforcement officers, they're guardians, they're helpers, but yet unless it was a repeat offender, for instance, I would have no way of knowing a person on a narcotics call possibly also had those mental health issues behind the scenes, or maybe had already been admitted for that, unless it was somebody that I knew and recognized. So it's tough on our men and women who are out there every day and dealing with these issues and trying to get these people the help they need to try to identify and try to make that, what is this? What do I have here? Is this just a narcotics call and this person needs to be arrested? Or is it a narcotics call with a mental health issue and we need to take it in that direction? And those are calls that they have to make every day.
There's another thing, and here I go off script again, and I'm sorry, but it's great to have a dialogue with two people who really know what they're talking about. I love it. Because you not only, you're practitioners, you're in the field, but you also appreciate evidence-based practice, and you're researchers and you're interested in research. So that's like really cool. One of the things that I do in my free time, usually like about 3 o'clock in the morning, is, no, I'm kidding, but sort of not. I'm an expert witness. I've been doing this for decades as an expert witness for how the police handle people with mental illness. So people will, law firms will hire me to like review stuff, and it's usually wrongful death lawsuits, usually, because so many times the police will respond and something will escalate and the officers' lives are in danger, and then they have to use that ultimate deadly physical force, which we never want to do. The safety of all is paramount. When a police officer is called to the scene of a Baker Act or a person with a mental health crisis, the police are there to help. And I want to say like 8 times out of 10 or 9 times out of 10, it's without incident. It's either going to be a voluntary or an involuntary, but there's no injuries and minimal amount of force is necessary. But then there's that one time where, of course, and that's always, that's always blown way out and shown on every news station. And no one ever, we never want to take someone's life. We never do. That's not what we do. That's not what we want to do. But sometimes this escalates because it's baked right in, no pun intended, into the Baker Act, right? That if you're a danger to self or others, and others can be the police officers themselves. So sometimes this escalates to a point where deadly physical force is needed. One of the things you found in looking at the actual data is that Davie mostly is without force. Am I right in saying that, Matt? What did you find?
You're 100% right. They're significantly below the national average, and as I said before, it's because of their training. It's because of their dedication to find out what's going on. It's because they're willing to take the extra step. They're not taking everything for face value. I don't know of another agency. Obviously, I don't know them all, but I don't know of another agency that is seeking help from a local college to have research done on their city. And not to mention, the chief had no idea what this was going to reveal. It could have hurt them, right? It could have showed negative statistics, but they were willing to be fully transparent. And in the end, I truly believe it's going to help them and the community.
Chief, do you want to weigh in on what I was talking about in terms of it's the outlier where force is needed or deadly physical force, God forbid, and how your department kind of like it's without incident almost all the time.
Yeah, you started off by saying no police officer wakes up and says, I want to shoot somebody today. That's not the case. And I've been in my 33rd year of law enforcement right now, and I have to tell you, of all the statistics, reading Matt's findings and Matt's report, that was the one that probably made me really happy to be the leader of this agency, because the men and women who are on the streets every day and doing the actual police work recognize the fact that use of force is something that should be used as the exception, not the rule. And I'll tell you, I can't take credit for that. I give 100% of credit to our training staff in the police academy and the extra time that they put in with these men and women to make sure they understand. We're constantly, Chief Poole and I constantly are reminding them and encouraging them that, hey, de-escalation techniques, they work and they're important. Duty to intervene is a big thing that we do here at the Davie Police Department, and all 3 of us were in law enforcement, and we let them know, hey, sometimes even cops, we're human, right? And our tempers might get the best of us, or the adrenaline is going, or the situation gets heated, and we want to make sure that we can intervene in that situation and take the other officer away for a second and say, hey, just go catch your breath. Things are getting a little heated, and maybe we can settle and calm this situation down before it gets to that use of force. And so those are things that are constantly being taught to our men and women from the first day they step foot in the Davie Police Department to the day that they retire.
Excellent. And Matt, I want to just pitch this one to you. Now that the study is done, what's the next steps? What's the next steps for Davie? Are we going to continue doing some type of research, some type of training? What do you think? What are the implications of your findings?
Well, first and foremost, I'll cover some of the implications. I think we covered most of them, but we did find that officers trained in CIT will bring a person in for a Baker Act at a higher rate than those that are not. We also learned that officers with a higher tenure, being on the job a lot longer, about in the 20 to 25 year range, actually Baker Act at a lower rate. And we believe that's due to their experience and finding other methods to mitigate that mental health call for service. Future research, I'm super excited about. It's probably going to be another show, but
That's right.
we're continuing with Davie. I think the research showed how important training is. So I won't give it all away, but we're definitely looking at utilizing VR methods to better inform officers on both developmental and behavioral issues, and
Yes.
how to determine what it is. And in virtual reality actually puts the officer in the position of the victim and gives them that experience. So we'll see how that turns out, but that's not a 40-hour class like CIT every couple of years. This is something they're going to be able to do in their car, in between calls for 5 minutes. They throw these goggles on, obviously in a safe environment, and get some quick training. And I think it's really going to help out. And something as little as the Davie Police Department wondering what's going on in their city with Baker Acts could lead to hopefully a county or statewide effort to implement this new training protocol.
And I think that Davie Police are leaders in and pioneers in the special registry, and something that was mentioned earlier about autism spectrum disorder, that oftentimes it could look like a mental health crisis when it's more symptoms of ASD. And Chief, we in anticipation of future research, we started already a qualitative study that you picked the cream of the crop. I'm sure that they were these 7 officers that I was just asking them about their knowledge really about autism spectrum disorder and mental health crisis. And I'm telling you, these seven people were trainers. They're like, I feel like there's nothing that we could actually teach them, to tell you the truth, like that they were so knowledgeable and so articulate and so compassionate and kind and caring that they're like the poster children for law enforcement. Really, I can't say enough about them, Chief. Really.
Yeah, like I said, I'm fortunate to be surrounded by outstanding men and women who are not only great police officers, but they're great people, and they care about this community, and they're going to take the steps they need to try to identify, what kind of help is best provided. And as Matt alluded to, I got to give credit to my boss, the town administrator, Rick Lamack, and our town council. When we decided to purchase that VR simulator, they provided us with the funding to do that. We were able to buy the top of the line one that was available. And there's thousands of scenarios now that we can put our officers through, again, whether it's 5 minutes or something more extensive. We all know about training. You have to keep doing it, adult learning, or you're going to forget. So
That's right.
something we're going to keep doing that moving forward. It's never going to stop as long as I'm sitting in this chair. And it's beneficial to the officers, but it's also beneficial to the community, especially those in need.
And these 7 guys and gals that I interviewed recently, I was just asking them really just their perceptions and their knowledge about autism spectrum disorder specifically. And they talked about what you have, the simulator, and they talked about the autism spectrum disorder scenarios, so that there are scenarios already. And at the end, when I asked them, do you think that more training is needed? And every single one of them said training is always needed and welcomed. And I just think that's just so perfect, because there's not only humility there, but there's this understanding and awareness that, yeah, I mean, this is our profession, so we always want to be polished as much as we can. I mean, look at baseball players. Even though they're in the World Series, Friday starts, they're still practicing, right? The Dodgers? Did you just say the Dodgers?
I did.
Okay.
Sorry, but
That's okay. Matt, what do you want to weigh in on any of this that we're talking about, like for future research and the research that we're going to be doing, hopefully with Davie in the years to come?
Well, like I said, I'm excited about it. I think, from my perspective, we should help first and hospitalize last, right? So we have to find other methods to mitigate this mental health crisis, and most importantly, it's a societal issue that unfortunately is thrown onto law enforcement to deal with. So, like Chief alluded to earlier, we do many things out here, and it's not something we can just say we don't have time for that. So the responsibility has been placed upon us. So we have to prepare our officers to deal with it as best we can, because realistically, in the end, all the liability falls on us and those unfortunate incidents. And we have to prepare not only our agency, but I don't think anyone wants to send an officer to a scene where he may have to use lethal force and then ultimately change the lives of the victim and his or her life, right? Because we also get affected by that, and that trauma is very long lasting. So I'm really looking forward to kind of changing that pathway forward and having these collaborative sessions with local departments and getting city and counties involved, and obviously funding is a huge issue, but I think the burden needs to fall on the cities and the counties to assist their law enforcement to keep them out of these crazy positions.
Yeah. So we have about 10 minutes left. I want to go to the audience because there's a lot of questions.
Uh-oh.
There's actually, and they're not directed necessarily at one specific guest. So it's just going to be like, who wants to take it? All right. So Alyssa Garcia, she's a introduction to criminal justice student. She has one of our adjunct professors, Dr. Sverdlik. How does the Davie Police Department, well, I guess that would go to you, Chief. How does the Davie Police Department decide when an officer versus a mental health specialist should take the lead? That's a very good question. She's talking here about co-responder.
Right. And so unfortunately, that's still a work in progress for us. When I first got here, we reached out to a couple local providers and tried to have that co-responder program put into place. It's government. So for a variety of reasons, we weren't able to make that partnership work. So that's something we're still working on. Uh, that's a goal of mine moving forward, just like my goal that I stated earlier about 100% CIT trained, is to get that co-responder. When that happens, then obviously the officer would defer to the mental health professional, because that's why we're bringing them out there. Again, as good
Right.
as my men and women are in identifying these type of issues, if you have someone who does that for a living, who's been trained in that arena, then obviously we would defer to the mental health professional.
Yeah. And what about Henderson Mental Health? Also, a call comes out and then you can request Henderson. Is that how that
Right,
works?
right. Yeah, and without that official partnership, but yeah, we always can request the assistance from them and try to get them to come out. Again, it's a busy county, 2.1 million people. So it's not always something that can happen right away, but
That's right.
we're always going to look for help. That's just like what you said about the training. We always are going to continue to train. We're going to continue to learn, and we're not arrogant enough to think that we have all the answers. So we're going to reach out for that help when we can get it. In the days that we can't, we know that our men and women are trained enough to make the right decision and to do the best they can, again, because we're all about trying, like Matt said, we're trying to help these people. Jail is the final resolution. That's the final answer. That's the last case scenario for us, unless there's some sort of immediate threat to us, and we have to take that action. We're looking to partner with people and get the people that need the help, get them the help.
Right. And Henderson Mental Health doesn't have the same amount of personnel, the same amount of resources. And so if a police officer on the scene is going to reach out to Henderson and they're on their way, it could be 45 minutes later. In the meantime, what does the officer do? The officer has to use all of his verbal de-escalation techniques, all of his whatever the de-escalation that he can do verbally, and it's like stalling, so you're kind of like, do we want to play cards right now? Like it's kind of like that. But at the end of the day, even when Henderson arrives, if they can get there at all, then the bottom line is if it's going to be an involuntary custody case, the officers still have to be involved, and the officers still have to be the ones. Am I
Right. And,
right?
and again, and when you're in that situation where the response time may be 45 minutes to an hour, that person that you're dealing with a lot of times with those mental health issues, especially if there's narcotics involved, they're going to get agitated. And now this might take a different direction. So it is challenging. I mean, it's challenging across the country. It's challenging again in Broward because we have so many municipalities. We have a very large sheriff's office, and it's challenging, and they're busy, like we all are. So again, we do the best we
Yes.
can with the tools that we're provided with, and we're going to just keep working towards a better solution and a better partnership.
Great. One of the questions from another intro to CJ undergrad is, and I'm gonna pitch this one to you, Matt, because the question is, are police officers required to have education or training in psychology? Now, you went all the way. Not only do you have like just a little bit of education, you have the whole thing, right? They say that, a BS is, what, BS, right? An MS is more of it, and a PhD is piled high and deep.
Well,
So Matt, you're
my
piled high
PhD got
and
me on
deep,
this show.
man.
My PhD got me on your show, so that's good.
Yeah, that's right.
No, we're not. Police officers aren't required to have education. Obviously, there are certain, supplements and pay increases if you have education, but it's not at all required. I really started looking towards my education because I found myself getting very one-sided early in my career, and it's referred to the us versus them mentality that a lot of young police officers go through. The first couple of years of policing is very traumatic. You go through a lot of different identities and try to find out who you are and the new position you're in. So I really wanted to understand the us versus them and why I was feeling that way. And I felt the best way to do that was to get education and go as far as I could and understand that other side to make me better at what I did.
Okay, that's awesome. Chief, I'm going to pitch this one to you because it has to do with autism spectrum disorder. So, one of our PhD candidates, Jamie McCarthy, is saying that identifying an ASD person, someone with autism spectrum or on the spectrum, the ability to identify a non-hearing person, the need to the need for correct training and more intently continued training to identify is so necessary. What training, if any, is there on ASD besides the ones that I just now said that is part of your simulation?
Yeah, I mean, you're going to get some basic skills in the police academy. We try to so we have our men and women when they're hired by Davie, we put them through training before they go to the police academy and afterwards. So although the police academy does a great job giving them the basic knowledge of things like that, we're trying to provide enhanced training for that, and we're also trying to provide the train the trainer. So any chance I get, the partnership with you all, but any chance I get to send some of our trainers to a school or to bring somebody in and we have a community room downstairs where we host a lot of classes and try to get as many of those officers in patrol and the other units trained in that because it's again, we're police officers and but we're asked to do a lot of different things and we don't have the formal education as high as Matt does or even a master's degree. But that's just something that is difficult to assess at times, and we just try to give them just develop more of those skills than they just get in the police academy.
So, Matt, there might be some questions here from your PhD colleagues. Eddie, are you ready to pick three for me? Three good ones from the webinar?
Yeah. Did you mark off the ones that you've already asked?
I can't hear you.
Sorry. Did you mark off the ones you've already asked?
No, I just did YouTube. So
Oh, okay.
if you could just
Perfect.
pick the three in the three short ones maybe because we only have 6 minutes left. So if we could get three, if not, let's just take them one at a time, see how long it goes.
Okay. Yeah.
You got a good one?
I think so. Yeah. So Joshua Blotzer asked, I believe roughly somewhere in the neighborhood of 20 to 30% of law enforcement interactions involve mental health issues. Why does it seem like mental health related training is not a higher priority?
Chief, you want to take that first, and then we'll go to Matt?
Yeah, I mean, I can't, we don't set the criteria for the police academy's instruction. That comes from the state, but it's a priority for me. I can only control what's in my purview, which is the Davie Police Department, the town of Davie. So although we talk about that a lot, and I'm president of the Broward Chiefs. I sit on the board of directors for the Florida Police Chiefs. These are conversations we have across the state because we're all trying to do better. But as far as the Davie Police Department, it is important to us. And our men and women know, again, that we're guardians 99% of the time and we're warriors 1% of the time. So we're there to help, we're there to protect, we're there to serve. It's not a cliche. And I can control what the Davie Police Department does, but I can tell you that in dealing with all the other chiefs across the state of Florida, I just came back from the IACP conference in Denver a couple days ago. That's a conversation that all the chiefs at the international level are having. So we're moving in the right direction, but you can't turn an aircraft carrier that quick. So it may be a lot slower than people want or people need, but I could say we're doing the best we can. And here in Davie, we make that a priority.
Great. Thank you. Eddie, why don't you give me one more, a good one?
So Sandy Rao asked, how does this state of hypervigilance as described by Dr. Gilman in Emotional Survival for Law Enforcement influence officers' mental health and family relationships, both immediately and over time? And what organizational policies or personal strategies would you suggest to mitigate the dangers of ongoing hypervigilance?
So when we say hypervigilance, Matt, you want to handle that, and then we'll go to the chief.
Yeah, I need a summary of the question though, because it sounds like a couple questions. So she
It
asking
is.
how the officers deal with the traumatic effects, or
Yeah, so it was like part one is how does it influence officers' mental health and familial relationships? And then what strategies would you suggest to mitigate that?
well, I mean, law enforcement in general. I mean, um, so there's a study that shows within the first 4 years, at approximately year four, police officers are at their most vulnerable stage because they go through a series of identities where they're trying to find themselves, like I mentioned before, and they're trying to identify with, police. They're trying to, blend in with civilian. They don't know how to deal with their families. So it's those first 4 years are very vulnerable time for officers to actually deal with the everyday stress. I think very important things to deal with it are, like I said, separate identities. So police is what we do for a living, but it's not who we are. So you have to be able to, um, you know, decompartmentalize and get outside of your job and have friends and family that you have a strong core and you're able to discuss issues with them. But I want to preface that by saying, you know, officers need to really have a conversation with their families and let them know the stuff that they're going to talk about, because there is secondary trauma that can be gained by family members and friends. So you want to give them a good heads up on what you're about to discuss, but you definitely need someone to talk to with strong social core.
Chief, do you want to weigh in? Hypervigilance, like I think that sounds very much like post-traumatic stress disorder, which many of us might have as a result of our police careers.
Yeah, I mean, we talk about health and wellness for our officers all the time. There's not a day that goes by that we don't talk about that. From the first interview when they sit in here and I'm trying to decide to hire them, I ask them that question. I go, how do you handle stress? And we give them all the tools we can give them. We provide them on duty time to work out, because that's a way a lot of people can relieve stress, is going to the gym. When I talk about duty to intervene, I'm not just talking about on a call. I'm talking about when you see your buddy, your friend, who may or may not be going down a path, whether it's substance abuse or not paying attention. We're on red all the time when we're at work, so they have to learn how to step back from that. And they're probably tired of hearing me saying it, but I've said my entire career, family first. Like, don't use it or lose it vacation time. Like, Davie Police should not be at the top of your priority list. Take care of your family, spend time with your kids, your partner, your friends, take vacations. We're going to be here when you get back, but that is so important for your mental health, to be able to step away, to get out of that red zone and to get into green and relax. Whatever it is that you do to relax, whether it's vacations, reading a book, going to the gym, and we talk about that constantly because it's so important and it so impacts how your work environment is. So what your life is like at home and your ability to decompress and get away from the job. And we all know that, we're cops and it's tough to do that, but that's something that we stress here at Davie. And again, family first always, wherever or whoever your family is.
Absolutely. That's why I moved to a 5-acre ranch so that I could have 2 horses, because otherwise it's always about work, 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 and stress and work, and you have to have that outlet. I want to say thank you to you both so much. What an important and timely conversation. Tonight, we examined very real challenges that sit at the crossroads of policing and mental health, challenges that affect not just individuals in crisis, but families, officers, and entire communities. And evidence-based policing is, I think, what we're seeing right here. I just, give you guys the last word. We'll start with you, Dr. Goodnow, and we'll end with the chief.
No, thank you very much for having me. I apologize for not being able to get to all the questions. They can certainly email me at mg2736@nova.edu if they want to discuss anything further. Thank you again, Chief Kinsey. It was awesome. I look forward to continuing our research together, and just thank you for your partnership, and I look forward to continuing it.
Thank you so much, Dr. Goodnow. And Chief Kinsey.
Yeah, Dr. T, first, thank you for having me. This has been a pleasure for me to be able to share this experience with you. Obviously, thank you to you and Matt and Nova Southeastern. I mean, us being able to reach out to you and have that partnership, and for you to take this on and provide this level of reporting and findings, and it's educational for me. I always try to keep learning as well. And yeah, we didn't know what the results are going to be when we asked you guys to take this on, but we did find out that I think we're doing a lot of things the right way. But nobody's perfect. We're not here perfect at the Davie Police Department. I'm certainly not perfect as a chief. But we're going to move forward. We're going to keep learning. We're going to find new and innovative ways to help our officers on the street, because as the world changes, they have to change with it. And this isn't policing in the 80s or 90s anymore when I started.
Right.
And we can't do that alone. We need these educational institutions. We need people like you and Matt that can help us be better at our jobs. And that's what we're going to continue to try to do as long as I'm sitting here.
Thank you. Thank you so much. Thank you for the partnership. Thank you for the relationship, the friendship, and thank you for just who you both are. And so that wraps up our show for tonight. Next Thursday, we have actually 2 different topics, same church, different pews, perhaps. October 30th is next Thursday. Active bystandership and current trends in policing with Dr. Abigail Tucker. She works for us at the Fishler College of Education School of Criminal Justice, along with Jonathan Aroney, an attorney. So we're going to hear about what is active bystandership and current trends in policing, and it's research-based. And also one of our, and I think Matt is friends with Christine Dupre, and she's going to talk about impact of police response on sexual assault survivors. So it's going to be a jam-packed show next Thursday, but don't forget to join us. I want to say thank you to Dr. Durham, our dean. Thank you to Eddie Hammonds, our project manager, and to all of you who have joined us, and thank you so much to the faculty who have encouraged their students to join us. Thank you again. Have a great night, everybody.